well. But let's begin with this story where the President, Bola Tinubu, will soon sign an executive bill that will cut down the high price of medical consumables and other pharmaceuticals. The new legal framework will also create an enabling environment for local manufacturers to thrive, as well as ensure healthcare regulatory agencies are funded. TVC News State House correspondent Femi Akonde has details.
The soaring cost of pharmaceuticals has slowed down access to healthcare across the country. But the Coordinating Minister of Health and Social Welfare says President Bola Tinubu has approved an intervention that is consistent with the Renewed Hope agenda and will ultimately make healthcare affordable and accessible to all.
Mr. President's intent is that we begin to take steps to enable the local manufacturers to survive, to thrive, and to deliver the basic commodities that are key to saving their lives. And he directed that the Attorney General of the Federation work with us to come up with an executive order.
The explosion in Ibadan that has caused severe devastation got special attention from the Federal Executive Council. Also, a committee was set up to investigate the circumstances surrounding the explosion in Ibadan, capital of Oyo State, and ascertain if certain laws regulating the handling of explosives were not followed.
That was why the committee was set, to look at the law, the rules, to see where the chain is broken, and to see how it can be fixed. You all know there is strict rule on the storage, movement, and ownership of explosives.
The Attorney General of the Federation talked about a bill that will be sent to the National Assembly for ratification of the agreement between Nigeria and the United Arab Emirates.
The Council noted that the agreement between both countries, that is between Nigeria and the United Arab Emirates, include personal income tax, company income tax, petroleum profit tax, information technology, levy, tertiary education tax, and capital gain tax.
In Nigeria and the UAE, and with the approval, we can now send the already signed IPPA to the National Assembly for ratification. And also, the Council also approved that the Minister for Industry, Trade and Investment should also immediately invoke Article 26 or so.
This first FEC meeting in the 2024 fiscal year is also part of the process of implementing the 28 trillion naira budget of Renewed Hope signed by President Bola Tinubu on the first day of the year. Femi Akonde, TVC News, Abuja.
All right, this matter of the high cost of medication and other pharmaceuticals have been a major concern for a lot of Nigerians. Just this morning, I was listening to a radio conversation where someone called in and he said that he can't find his medication as it is. He is asthmatic and he can't find his medication. And we have seen other patients who are dealing with some issues, for instance, diabetes, how it is that the costs of their medication has skyrocketed by 100%, so to speak. So this is a good intention
True.
by the president to wade into it, because we have seen some of these pharmaceutical companies leave the country. How we can bridge that gap is what we have been looking at, and this step being taken, we hope that it achieves its purpose.
We do hope so, because like you said, some price of drugs have increased by 100%, some over 100% actually.
Yes, yeah.
And it's quite horrific that healthcare in this part of the world is quite expensive. And so without the aid of HMOs, a lot of people won't have gotten
Even
proper,
at that.
Even at that, yes.
How much care can you get from the HMO?
But at least
it depends on the cover.
Depends on the cover,
yeah.
Yes, and what you're willing to give out to get extensive coverage. So this is a welcome development, but my own concern is based on implementation.
Right.
Yes, if we have laws that will ensure the reduction in prices of medicines and drugs and all of that, how do we implement it? Because government is high up there giving these laws and all of that. But deep down, how do we as a people go about implementing these laws? Because you go, for instance, let's look at the days of subsidy. Some petroleum marketers take the fuel that we have here to neighboring countries and sell at this particular price.
Right.
And coming back to the government and said, okay, we have sold petrol to your people, pay us money.
Right.
We're collecting money for not delivering on the goods.
To the people
To
it
the
is meant
people
for.
it's meant for, yes.
Right.
So if we are saying, okay, we have these laws, drugs, this will ensure that drugs the price of drugs will go down. What about coming down to the people? Because you get to the market, I'm sure you understand, you get to the market and you hear the likes of, now dollar costs more. Everybody's
Because we are exporting.
Yes.
Or we are importing, this
and
medication.
Using dollars to offset a lot of things out there. Even if you're importing it from China, you still use dollars
You
as
use
well.
dollars to import.
Yes.
So how much of the raw materials do we have
here
in the country?
So
How
it's
much
easy
can we
for-
explore?
Yeah.
If we say we have some of the raw materials, how much can we explore as it is? What's the enabling environment for these people?
Yes.
When you talk about credits, they are talking about double digits and all of it. So are we also looking at how they can also address those issues? Because these people who play in the sector have spoken to these issues, that if the government had created that environment where there was some level of competition with these other companies that have left, that perhaps at that time we would have had some level of stability that we are looking for at this time with regards to medication and availability of pharmaceuticals. But we do a lot of importing, and these people cannot necessarily play in the space because they have to, when they get credit from banks, it is double digit, so they are not making as much profit as they intend to. So it's also very dicey. I don't know if government is looking at having conversation with the banks to look at how they can ensure that there is credit availability for these persons and maybe at single digit rate,
Yes.
as it is. Then there's also the Nigerian factor.
There's a Nigerian factor.
A lot of persons who are importing, yes, we know dollar, but some of them are taking advantage
Of the increase in price of dollars.
of the whole situation.
Yes.
You can see, the other day I had to get medication for someone. In a particular area, the prices is high. In another area,
it's a different price.
it's a different price. And I had to be explaining to the person that perhaps it's because these persons in this area feel that it is a situation that is common to people who live in these kinds of areas as against this other area. But the question is, why would we do this to ourselves?
Why? And also, like in addition to what you have said, multiple taxation as well is eating deep into our pockets, because there are times I go to the shopping malls to buy food or to buy groceries, and with each item I'm buying, I'm being taxed per item. And it's annoying because you're spending money that is scarce, yet you're paying taxes in multiple folds. So these are the issues that have to be addressed as well. Then also homegrown solutions. We don't have to look at the West to get these things. We have homegrown solutions that even the West can come in.
Wait, so are you talking about Agbo, or which one?
Yes, herbal medicine. Yes, we talked about it last week, Friday.
Yeah.
We had a guest. Homegrown solutions will work for us, because if you realize, many people that do not go to the hospitals go for these things. Sometimes, for instance, have you not seen someone that has a broken leg? Rather than go to the hospital to spend money, they go to someone.
I know we would have loved to continue this conversation, but it's a lot. This matter of homegrown solution, the challenge is understanding the amount you can take.
We can work around that.
We can
work around
so
that
the government
perfectly.
Can build on that. See how we can have conversation with persons.
We have the herbs. We have everything here.
Yes,
so
we are blessed.
We are blessed.
Right. Let's leave the conversation here now. And